Kia ora koutou, ko Bronwyn Scott tōku ingoa, mahi anau hei kaupapa lead o DECA, Digital Equity Coalition Aotearoa. No mai, haere mai. Hello and welcome everybody. I am Bronwyn Scott, the kaupapa lead at DECA. Me karakia tātou. Whakataka te hau ki te uru, whakataka te hau ki te tonga, kia mā kina ki uta, kia mā taratara ki tai. E hi aki ana te ata kura. He tio, he huka, he hauhu, tihei mauri ora.
Tihei mauri ora.
Kia ora. So thank you all for joining us for this hui today on resilience and techno-stress. So much now runs through a digital front door built on the assumption that everyone can manage it. Today we ask what that costs older people and what better design looks like. So for the next almost hour, there'll be some kōrero between myself and our guests, and there'll be a bunch of time after about the halfway mark for some Q&A. We have Mari from the DECA whānau in the chat, so please use that function at any point. Feel free to introduce yourselves, and we also welcome your whakaaro and partway, your thoughts and questions. This hui is also being recorded, and we'll share that out on our comms channels really soon. So let me please introduce our guests. First up is Dr. Dianne Wepa, Ngāti Kahungunu, Associate Professor in Māori Health from Auckland University of Technology. Dianne's study used Kaupapa Māori methodology with 14 whānau in Ngāti Kahungunu, interviewed across COVID-19 and, as it happened, partway through Cyclone Gabrielle too. It looked at how kaumātua Māori use digital technologies to stay connected and reach health services during those two overlapping crises. Kia ora, Dianne.
Kia ora. Kia ora, everyone.
Also joining us is Melanie Stowell, PhD candidate at the University of Auckland. Melanie's study interviewed 23 community dwelling older New Zealanders aged 65 plus about mental well-being and digital technology. Her work has had a recent run on RNZ and in The Conversation. Kia ora kōrero, so good to have you here.
Kia ora.
All right, kicking off our questions. My first one is for you, Melanie. Your work brought the term techno-stress into how we talk about older people and technology. For anyone hearing it for the first time, what does it actually look like in someone's everyday life?
Yeah, so techno-stress is a term for something that many of us may experience. It's a term that was traditionally used to describe the types of stress amongst workers around the need to constantly adapt and upskill in the technology they needed to complete their tasks. It's essentially about the struggle we might experience mentally to cope that we may feel around new and changing technologies. And more recently, techno-stress has been used to describe the technology-related stresses amongst older people and other groups that may experience digital exclusion. So it's the idea that technology itself can be a source of stress in our everyday lives. The stress can be from a number of reasons related to the use or the expectation to use digital technologies. In the research I've done for my PhD, I've been learning about some of the technology-related stressors that older people may experience. So this may include needing to unlearn and relearn the same app after it updates and changes the interface completely. It could be the constant fear of being targeted by scammers, and just the pressure to use technology for an increasing number of our everyday tasks. So all of these types of factors can contribute to our poorer sense of well-being, frustration, anxiety, and maybe even a reluctance to go online at all.
Well, there's a lot to unpack there. I look forward to getting into the thick of that a bit more as we go. Dianne, your study followed kaumātua Māori through COVID-19 and Cyclone Gabrielle. What drew you to look at digital technology specifically, and what did you find that you didn't expect?
Kia ora. During COVID-19, what we saw, well, we all saw that health services were rapidly moving online with telehealth, online appointments, QR codes, and patient portals. So they suddenly became the norm. And while these changes improved access for many people, I was interested in what that looked like for Māori kaumātua elders, particularly in rural communities. Then Cyclone Gabrielle happened while we were collecting the data, and that unexpectedly gave us a second crisis to compare with the pandemic. And what surprised me most wasn't the technology, it was the resilience of the participants. And every challenge they described was met by someone stepping in. It might have been their mokopuna, their whānau, their own children helping with online appointments, say their daughters filling out their forms, marae checking in on them, or a local health provider finding another way to assist them. So the research reminded us that resilience doesn't sit in technology, it sits in relationships. Thank you.
Yeah, that's an incredibly powerful thing to remember as well. We use a phrase, the invisible workforce, and I'm sure a lot of us have stepped into that helper role quite a few times with our friends in whānau. So when the strain is at its sharpest for an older person, what does that actually look like? I wonder, Melanie, if you could take that one.
Sure. So in addition to the community members I've had the pleasure of doing interviews with, I've also spoken with subject matter experts. And one of the most helpful ways I heard it summarized is that digital exclusion at its worst can lead to the shrinking of someone's life. So this means it can impact on all areas of life and well-being, from access to services, building and maintaining social connections, staying up to date with the news, you name it. But ultimately, as the world we live in is increasingly digital first, digital exclusion can impact a person's confidence and ability to maintain their independence and well-being.
Yeah, and having our kaumātua retain their independence is super important. Dianne, there's a line in your study, go online, nobody around to help. Can you tell us a little bit more about that?
Sure. That quote really captured the experience of most of the participants. One kaumātua reflected that years ago there had been a local healthcare clinic, because we're talking rural and remote areas, so it becomes like a community hub, a bit like schools in marae. And so there was a local healthcare clinic where people could simply walk in and talk to someone. And increasingly they were told to go online instead, of talking to someone. But if you don't have a computer, reliable internet, or someone to help navigate the technology, you're effectively excluded. And the important point is that digital services should expand access, not replace human relationships. And technology works best when it's supported by trusted people within communities. And when, even when you go to a retail store and they say go online, you think, well, you won't have a job if I go online. So there's something embedded in that phrase that I think we need to really look at the assumptions around that statement. Thank you.
Yeah, for sure. You raise a good point around relationships and trust. There's a framework for digital inclusion. To all these things need to be in place to make sure that somebody is digitally included, and it's called IMASTS, the IMASTS framework. So the I identity, motivation, access, skills, trust, and safety. So all of those things need to be thought about to make sure that somebody is digitally included. Sticking with, actually, what am I going to do here? Here we go. So both of your studies show that older people aren't doing this alone. There's a grandchild, a navigator, a whānau member who's actually doing the work of keeping people connected. And is that work seen or valued? Who wants to take this one?
I can give it a go.
Good stuff, Melanie.
I would say it's going to depend on the individual's context, right? So fortunately, there are whānau and friends and family who can help support anyone who's struggling with technology, and that's huge and amazing. And there are also lots of public services and nonprofit organizations who are providing support at no cost in local libraries and other community spaces. There are also some companies that are providing workshops and dedicated customer support for older people, and that's really great to see as well. But as we've kind of talked about already, a lot of the heavy lifting at this point appears to be provided by individuals who may not be paid for this work or may not be necessarily acknowledged for this important work, which is increasingly an essential service as the country goes digital first. So I think this is an issue across the aged care space. We rely on unpaid carers and volunteers to fill in the gaps, and with this area, it's no different.
In our research, it showed it's overwhelmingly whānau and community. Mokopuna were teaching grandparents how to use devices. Adult children were booking appointments. Marae and Māori health providers were helping people navigate services, and community organisations were often bridging the gap between government systems and older people. So much of that work is invisible, and it isn't funded or recognised as part of the health system, but without it, many kaumātua simply wouldn't have been able to access care. That's why digital inclusion isn't just about providing technology, it's about investing in the relationships that make technology usable. So I agree, what was said about the individuals, although I think for Māori there's a much more of a layered approach required. Thank you.
Yeah, for sure. My next question was going to be around what happens to people that don't have that someone. And Dianne, you mentioned that they just simply wouldn't be able to have access to whatever it was that they needed. Melanie, did your research show something similar?
Yes, absolutely. And some of the people I've spoken to also acknowledge that maybe an older person doesn't necessarily want to rely on family or friends for this support. They'd rather go to a dedicated service for this. And when that's not available, depending on where the person is located, it does mean that there are barriers to accessing services. And although sometimes a non-digital option can be available, it can come at a heavy cost of time or a heavy financial cost as well. And so this is really becoming an issue about access to essential services.
I think just to follow on with that, what happens to the people who don't have that someone, that's where the greatest inequities actually appear. Without whānau or community support, people become isolated from healthcare information and social connection. So those already experiencing disadvantage become even more disadvantaged. And digital exclusion quickly becomes health exclusion. And that's why equitable digital design has to consider those who don't have someone to step in. Yeah, that's a really important point. Thank you.
Yeah, you're absolutely right, Dianne. It sure is. Just a reminder for everybody to keep popping your questions into the chat and we will get to them very soon. So Dianne, let's have a look at the crisis lens. When systems fail in an emergency, the people relying on a digital-only front door are the first cut off. What did Gabrielle reveal about how fragile that is?
It was so telling, and it's interesting when you're doing research and it's happening at the same time. It's really real time. So Gabrielle highlighted something very important. Digital systems depend on physical infrastructure. So when electricity fails and telecommunications are disrupted, digital health disappears. And communities can't access appointments, prescriptions, health information, or even contact emergency services. So what remained resilient wasn't the technology; it was the local knowledge, the marae, whānau, trusted community networks. So the lesson for emergency planning is that digital solutions need analog backups. We should never assume digital systems alone will keep communities connected during a crisis.
If you could change one thing about how services are designed for older people, what would it be? Melanie, I'll throw to you for that one.
Sure. So in my research, I've kind of taken an upstream approach to thinking about solutions. So what I've come to recently, based on conversations and interviews I've been doing throughout this work, is I think it'd be really great if we could reframe digital inclusion as a right rather than a luxury from all the way up at the top. Because at that point, then we can create the infrastructure and the guardrails that ensure that those who are digitally excluded are given access to the services they need, and hopefully also change the way we design technologies in a way that reaches all types of end users, not just the most abled or the people with the greatest access. It's quite idealistic, I know, but I'm really excited to see if we can work together on some solutions here.
So for me, I'd start by designing services with older people rather than for older people. This means involving kaumātua from the beginning, making systems simple and culturally relevant, providing face-to-face options alongside digital ones, and investing in community-led digital support. Digital inclusion shouldn't depend on luck or whether someone has a tech-savvy grandchild. It should be built into the way services are designed. Thank you.
You guys are speaking my language. This is great. Yeah, I couldn't yell from the rooftops loud enough that digital inclusion is a right, not a privilege. I know that the Citizens Advice Bureau recommends a public service design standard, designing processes and interactions wholly, with digital being one means or avenue for engagement. So what does genuinely supporting people look like as opposed to digitizing and hoping? Dianne.
Sure, without repeating myself. So it means recognizing that technology is only one part of the solution. Genuine support involves affordable internet, accessible devices, ongoing community-based training, and trusted local people who can help when things go wrong. From a Māori perspective, it also means working in partnership with Māori communities and recognising that whānau are central to well-being, and digital systems should strengthen those relationships, not replace them.
I would say, kind of echoing what's been said a little bit already, but having that genuine human support from trained professionals, that's a theme that's come up quite a lot in my work. One of the things I heard, though, that in addition to that human support, it's got to be human support with the right approach, I suppose. So I've spoken to some older community members who say that sometimes that family support can actually be a little bit challenging because the family support person maybe just does the task at hand and hands it back to the recipient. So some of the solutions involve actually training or support people, whoever they might be, to understand how to coach, how to encourage, and how to grant that skill and independence to the person needing the support so that they can learn and also go on to use the device on their own in the future. I also heard that, just to kind of bring it back home again, but chatbots are not really useful to a lot of people. It's got to be human support for technology issues, not more technology. And maintaining that human option on the other end is always going to be really important to people who are under distress or unable to access what they need.
Yeah, you're both right. The human element is super important here, and it's something that perhaps there's not so much investment in these days or at all. One more question that isn't in our prep sheet but has come through. Melanie, your work names ageism running through this. Where does that actually show up for an older person?
Yeah, it shows up on multiple levels, I've found. So there's a term, in addition to techno-stress, there's a term called digital ageism that's kind of growing in the literature. And it's this idea that as a society, whether intended or unconscious, we sometimes make assumptions about an older person's willingness or ability to engage with technology. And that's really where many of the problems begin, because that impacts how we design, how we develop and implement and deliver technologies to end users. So ageism has been something I've been thinking about as well in terms of how we develop solutions that are also strength-based, in addition to addressing any underlying ageism that people may be exhibiting, oftentimes without their awareness.
Yeah, it's interesting that you mentioned solutions. Have you seen, and as well as you, Dianne, any ways or examples of that things have been done right, even in small ways?
I've been fortunate to see things being done right all throughout this research, which is really exciting to see. From the end user side with organizations like Digital Seniors and Age Concern and libraries, all the way up to people who are aware of the issue and actually going and designing their own digital tablet that's designed for older people specifically to be able to use. So I think there are plenty of examples. There are also a lot of assistive technologies that I think are developed and designed really well and co-designing with the intended recipients. So I think there are lots of great examples. I think the challenge is to translate those approaches into the mainstream devices that people need to engage with every day.
For me, what's like a prototype is to have a phone that doesn't rely on the internet. So, like in the cyclone, when the telecommunications go down, and there were lots of examples in my study where people would go to the pop-up clinics, because of the technology issues, and so they would have to say verbally their health information, their address, anything like that. And what this prototype's looking at is if there was something in the background on your phone that was always uploading your key health information, and then the minute the internet sort of went out, it was almost like taking photos of it. So when you're offline, all you have to do is show, it's almost like a health passport. I know we've had those in New Zealand, but a digital health passport, and it's just got your key health information that doesn't rely on the internet being live at the time. So that was a key thing when people had to go in for their COVID vaccinations, because usually you ask your name, address, all the key basic health information, and a lot of the time it's verbal and people are writing it down and getting it wrong. So that's a really good prototype that I think's worth funding to see if that can come through as something the government would invest in.
Dianne, your recommendations include Indigenous-led digital initiatives rather than mainstream ones retrofitted. Why does who leads the design matter so much?
As I said before, when you have any sort of issue that needs resolving, you always look at the people that it affects the most. So if it's affecting older people, or Māori, kaumātua, it makes sense to involve that community in the design process. And so I think the examples like Aimoko, that's been around for a while, that was out of a need in the far north where the whānau couldn't access health services or go to their GP because of the distance. So they were able to work with the whānau to come up with working with the kura. And so someone would be trained in the basics because it was around skin conditions to have an iPad and then be able to take the photos and do some basic questioning of the child and then send that through to the GP. So I really do think working with the people that are most effective is the solution rather than thinking you've got an idea and then you impose it on them. So I think that's definitely what tends to work.
Yeah, thank you. Questions from the chat coming through. One from Duncan. In the public sector, there's a focus on making more services available online, but without a holistic approach that includes access to affordable internet services and devices and appropriate or accessible training services. Shifting more public services online will increase the digital divide. In local government, keeping rates low is always top of mind for elected officials. What advice do you have to provide internet access and training in an affordable and effective way?
That's a huge question.
It is, isn't it? Thanks, Duncan. It's a lot in there.
Yeah. Well, I think from my research anyway, I'm encouraged to know that we now have strong evidence to show what works. And if governments, health services, and technology designers genuinely partner with Māori communities, older people, we can actually build digital systems that are inclusive rather than exclusive. So ultimately, it's not a relationship. It's not a conversation about technology, because I think we can be sort of pulled along with the technology conversation. I think it's a conversation about people, relationships, and designing systems that uphold dignity, equity, and mana for all people. So co-designing really is where it's at. Pulling back the threads, like you're saying, the table and saying, what can we do that's going to create efficiencies? It's going to be acceptable, because when you look at research, acceptability by the participants is actually high on the agenda now, not the fact that I got a grant and I did well and I've moved on. And so funders are no longer looking at, okay, you did well in your research, what's the impact? So I think having researchers at the table, the evidence, as well as the digital experts who know how to bring it all together, I think it has to be a whole of systems approach.
Yeah, I echo everything that Dianne says. I think this is also an opportunity where researchers and communities can advocate for themselves. And thinking a bit further upstream again, going to these companies directly and making the case for providing an equity product. And I think that some companies have been responding to this. So, at the end of the day, if industries understand that a significant proportion of their target users are impacted by digital exclusion, we can work with them on making internet and training more available and affordable.
Speaking of affordable internet, there are a few programs out there that can help with that. The most recent one is a chorus equity fibre product. I would recommend that everybody who works on the grassroots goes and checks out the chorus equity fibre product. It could help some people. Coming back to your research, if you could add one more question to your study and run it again, what would you ask?
It's a good one, isn't it? Yeah. The so what? Because that's what research is about, eh? Okay, I've done this, so what? Has it really made an impact? Yeah, so I would definitely look at so what are the people that can make the decisions doing about it? You've got the evidence, and we do find that a lot with research. We keep coming up with the same issues and then the same possible solutions, but it's like, are people's ears, are they listening? And we see with Māori anyway, coming back to, the population group I've worked a lot with, when there's a crisis, the marae's opened up. When there's a flooding, Māori are very inclusive. They've always brought people in. And so there's a lesson in there around what you can work with when you actually don't have that much resource. So I always come back to it, it's about people, our intention, the technology, it's got a life of its own. It is what it is. But really, the common humanity is what we really need to focus on. What is it we all could do that we all have a win-win situation? We're all stakeholders in this. And what are the lessons from Māori culture that we could take to learn from, that help us all? And we see those examples all the time with Te Kohanga Reo, Māori language and et cetera, et cetera. So I think there needs to be more around working with the, Indigenous cultures who have lessons that keep being put out there, but it's whether the decision makers really want to hear that, because we do have an aging population and there are more Māori living to be older now, and they may not have the, the grandchild, the mokopuna around to help them. But Māori are very resilient and will adapt with technology as time goes on. But really, the partnering needs to be seriously brought together with all the decision makers. I don't know if I've answered that, but it's really the so what. So what are we doing that's going to make a difference?
I would say for me, it's kind of perhaps the most challenging question to answer, which is how do we make the case for a change in approach in terms of how we develop and roll out innovations without sacrificing the benefits of all of the innovations that technology provides us? How do we make the case that we need to strike a balance and maybe take a step back and question whether the latest tech or the latest device is really providing all of the benefits we expect it to, and what other harms? So I guess it's that challenge of how do we ensure that innovations continue in a way that's actually going to be useful to us in the long run.
Another question from the chat, and this is something that the Deka Kaupapa is seeing a bit, and super keen to hear what your thoughts are. Based on your research and experience, do you have any advice on influencing senior leaders in government to take digital inclusion seriously alongside digital transformation? The questioner writes, we're finding it challenging to keep digital equity on the agenda when strategic decisions are often driven by efficiency, digital uptake, and the needs of the majority. I'd love to hear what approaches or evidence you've found most effective. And I know I put a government spin on that, but that's definitely in the corporate world as well. Dianne, over to you.
Yeah, I think there's a hidden infrastructure that actually makes digital health, anyway, if we're looking at health, work. And that is, and I'm repeating myself, but it's the whānau, it's the marae, it's the community organisations. There's actually a wealth of invisible work, hidden infrastructures that I think are just not labelled that as a resource for digital inclusion. So I think we tend to silo it, like digital's there, people are there, but really there is actually a resource that really, I guess, hasn't been labelled. I'm just using the word hidden as an infrastructure. So I think more could be done to actually leverage what people are already doing. Like I said, the schools are a really amazing hub when there's an emergency. People flock to schools or maraes, or probably more schools, because they have to have the internet for obvious reasons. And so leveraging off the community that's already got strong partnerships it shows you're already ahead of the game to have digital solutions. So I think there's something going on that I guess the focus hasn't noticed, or it's being taken for granted, where I think that's the key takeaway. And it's and digital inclusion is a health equity issue, and good design should enhance human connection, not replace it. So, keep pulling it back, like Melanie said, with upstream, downstream, here and there, that kind of thing. And co-design is so important. But I think, yeah, that's probably one of the main things I would say from my research is that there's all these hidden gems of infrastructure that are just for some reason invisible to the people that make the decisions. So I think there's something there to use. And with older people, there's a wealth of experience of using digital tools anyway. So there is a lot of like ageism. There's an assumption, a stereotype that older people just aren't savvy enough. So there's a bit of that as well, the attitudinal beliefs around that when, older folks have actually grown up, seen the digital age coming about. It's not like they've popped out and all of a sudden just turned up and, oh, what's this? So I think there's some conversations around that too.
Yeah, there's a lot of just people not understanding what the digital divide and how embedded it is. And it's actually increasing. I remember there was a statistic put out there not so long ago, and forgive me, I might get the exact number wrong. It's something like 87% of passport applications are coming through the digital way. But what it doesn't measure is how many people are getting help being able to do that. So that's something to really keep in mind from the outset. It's like, oh, wow, everybody's or most people are able to get their passports online really easily. But yeah, I don't know about you, but I needed help getting my passport through the digital means as well. And I would think that I was reasonably savvy, but what about the people that rely on that invisible workforce so more?
It's invisible work, yeah.
Yeah.
And it's mostly on women too. Women tend to be the people that assist with these things.
The other thing to bear in mind is that we have some statistics on what the digital divide looks like on our website. They were just updated about a month ago, so definitely head on there and have a look. And we can also, the DECA team can also talk to senior leadership as well. We are advocating for digital equity, so feel free to pull us into those conversations if you're having a bit of trouble there. Melanie, did you have any insight on influence in senior leadership?
Yeah, I again echo everything Dianne said, but we'll just piggyback off that a bit and say I did speak to a couple of interesting topic experts who had anecdotal feedback on programs where senior leaders, tech company staff have been assigned to go in and volunteer as digital skills coaches. And this type of hands-on experience can actually be really illuminating for people that may not understand what digital exclusion can look and feel like. And I think if we could get all senior leaders who work in this space, whether it be government or industry, to actually just go spend a day understanding in the communities what it looks and feels like, I think that can have a profound impact on the decision-making process. Still to be determined about how we actually go about and make that happen.
Couldn't agree with you more, Melanie. Hey, it's time for us to start wrapping up. So I wanted to leave the last question for a little bit more future focused and hopeful. So what gives you hope here? Like what have you discovered that is hopeful? Dianne.
Sure. So what gives me hope is resilience of the kaumātua that we met. Despite the significant barriers, they continued adapting, learning, and supporting each other. And so, as I said before, I've been really encouraged that we now have strong evidence that works. So if governments, health services, and the technology designers genuinely partner with Māori communities older people and those that are in rural and remote areas, because they tend to be forgotten. We can build digital systems that are inclusive rather than exclusive. And like I said before, I'm just repeat myself. Ultimately, it isn't a conversation about technology. I think that's the key thing I'd like people to just ponder on, may or may not agree. It's a conversation about people, relationships, and designing systems that uphold dignity, equity, and mana for everyone. So the last 3 points, the issue isn't that older Māori or older people reject technology. The issue is that technology is often designed without them. And whānau marae and community organisations are the hidden infrastructure that make digital work. And digital inclusion is a health equity issue. And good design should enhance human connection, not replace it. Thank you.
Thanks, Dianne. I know that you've got a couple of other bits of research out there as well. Do you want to talk just briefly about what they are?
Sure. So I looked at 10,000 apps on suicide prevention, working with people internationally. And what we found is that people that are in a low time in their lives, that are thinking about no longer being here, sometimes they do go on these apps. And the best apps are the ones that have really good governance and, controls around how they're used rather than just full of signposting. So that was a piece of research I think would link really well with what's happening here, is around the governance around how the technologies going to be used and implemented. I'm really interested in that. If there's any funders out there that want to work in this space, to look not only with the lessons learned from that app, but look at a proof of concept on how how apps and technology can support people, especially when we go offline. I saw in the chat there are options, and Apple does a few different things. I think if there's something where you could do a pilot, maybe with a GP service and their population around what it is they want if the system went down. So I think working with people in a co-design way is really the way forward. Thank you. There is hope.
Yes, good, Dianne. It's good to see you so involved in your community and research and everything you do there. Melanie, what gives you hope?
I think everyone in this webinar gives me hope. And similar to my experience throughout this PhD is, around every corner, I've met a wealth of people who are very dedicated to this cause and working tirelessly on this issue around digital equity. And that's been really encouraging to see. And again, I think it comes down to relationships, of course. And so to see not only lots of people working in this space, but working together in this space to come up with solutions is really amazing. And I do feel hopeful that we can develop a quite loud voice in terms of advocating for change further upstream so that digital equity does get on the agenda and those decision makers can see all of the amazing work going on throughout Aotearoa.
Yeah, kia ora. And DECA can help with all of that. If anybody has any digital equity or inclusion related questions, please get in touch with us. We're more than happy to help. Nā mihi Melanie roa ko Dianne. Nā mihi nui ki a koutou. Thank you all for being here for this kōrero. As promised, DECA will share the recording plus any links via our channel shortly. And if you're not already, please sign up to the pānui and go check out those statistics on our website. Me karakia tātou. Kia whakaria te tapu, kia wāti ai te ara, kia turuki whakataha ai, kia turuki whakataha ai. Haumie, huie, tā
Hi,
ke.
Pierre.
Ka kite.
Kia ora, everyone.
Kia ora.